A group of 10 physicians who studied and trained abroad before coming to Canada to work in Regina's healthcare system have now filed a complaint with the Saskatchewan Human Rights Commission. The complaint alleges favoritism, racism, and discrimination, which happened under the watch of the hospital's new Department of Medicine lead. So for more on this complaint and what the group is seeking, we are joined by CTV News medical correspondent Avis Favreau. Good morning, Avis.
Good morning, Anne-Marie.
So walk us through some of the specific allegations in this complaint.
So, number one, before I start, this is important to hear stories like this because Canada is actively recruiting health workers from around the world to fill in shortages with nurses and doctors, especially in more rural communities. So you want to pay attention to complaints like this because this is very important. If you're going to recruit and they are, for some reason, not feeling welcome when they arrive, they either won't come or they won't stay. So the reason that we looked at this story is because it is 10 doctors. Now, all of them were trained abroad, as you mentioned. Some worked in the UK, but for some reason, things worked very well. They're in the Department of Internal Medicine, so they have clinics, but they also need hospital work in order to earn their income. And then there was a change or a shift in the department lead, they allege, and all of a sudden, the shifts, the most prized shifts, they weren't getting any of them. They say they went to white physicians. And so these doctors from Africa and from Southeast Asia felt sidelined. And when they complained, they didn't get anywhere.
What was the Saskatchewan Ministry of Health's response?
So we reached out. I mean, remember, these allegations haven't been proven, Anne-Marie, so, this is still unfolding. But they said that they don't want to comment on anything that is sort of in the legal realm. But what did happen is when they noticed that their schedules were changed and they felt it was blatant racism because this whole group of Black and BIPOC physicians were suddenly left off after being on these favored schedules. They did complain, and they said they didn't get much of a response, if anything. The only thing was an investigation by the hospital into the complaints. And they said that, and their lawyer told us that it's not really fair if a hospital investigates itself because there's a perception of bias. So they decided to come forward with their story. And you have to remember, doctors generally don't like to talk about what happens to them. They're very private, and there's a certain amount of fear.
Yeah. You highlighted, Avis, the thought that everybody thinks about is the fact that we are recruiting actively doctors to come to this country. We do have a shortage. We all know that. We've done those stories. So what structures, if any, are in place right now to take a closer look at discrimination and potentially racism?
Well, so I spoke to an expert from the University of Toronto who said her survey found that 70% of Black doctors in Ontario reported racism. And this is just a recent study. So everyone I talked to in regards to the story said that it happens. There are other human rights complaints similar to this, not in the same scope. So there obviously is an issue here. Some hospitals and health authorities are actively looking at this. The research shows that you have to have a physician and health workforce that represents the people they take care of. That's how you get the best communication and the best care. So what these researchers said, if you do not treat the healthcare providers well, it doesn't lead to good healthcare for patients. And this group of doctors, and I checked them on the provincial website, they're all trained. There's no complaints against them. They all received their training and passed whatever tests they require to function in Canada. So they're discouraged that they come here and they feel sidelined and they feel targeted. So is there enough being done based on what I saw working on the story? I think there's a long way to go, but we need to do more if we want to recruit these highly skilled people.
And to your point, one of the arguments that comes up a lot is whoever's doing the investigation, representation at that level also matters so that there is built-in understanding of what some of these physicians are concerned about. What is the group of 10 physicians from Regina looking for from this complaint?
They would like a change in leadership so that the decisions return to being, as they say before this change, fairly distributed among all the doctors. But they also would like to make sure that this doesn't happen again so that other physicians of color who come into their hospital don't have to go through this. It's been demoralizing for them. So I think their decision to come forward is to shine a light on this. I heard from one of the people I spoke to, the Black Physicians of Canada, that there are many, many stories like this across the country, which surprised me. I thought that in 2023 we might be a bit beyond that, but across the board, I've heard racism still exists, and it's not good for the healthcare providers or for the patients.
Ava, it's always good to talk to you. Thanks so much.
Thank you.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.